You know that if you have intact reality testing, then you know that you're mentally ill and you will seek help. But if you have lost your reality testing and go psychotic, then you think there's nothing wrong with you and you won't seek help. And this might be a matter for coercive psychiatric treatment. But even from this clinical standpoint, where you're focused on, will this patient seek help? Will they be compliant with the doctor's orders and so on? It's more complicated than that because both research and some anecdotes I could draw on goes to show that first someone might have what you call intact reality testing and yet not seek treatment for lots of reasons, often bad previous experiences with mental health care. And on the other hand, people can be psychotic and deny that there is anything wrong with them. And this is the more anecdotal part, but I have heard from at least some psychiatrists that you sometimes get patients like this who still come to the doctor because they like the doctor and trust them and they feel distressed. So they still go to the doctor even though they don't think of themselves as mentally ill. So even from this sort of clinical treatment standpoint, this distinction might not always be the most important for practical purposes. And from a more first personal perspective, you can often sort of slide back and forth across this line. It's not always so clear cut, even to yourself, whether you think of these experiences as a psychiatric problem or this is happening to me. So this distinction need not be the most important one, even though it's often treated as the absolutely most important one in psychiatric encounters. So let's move on to some other distinctions among the different dissociations that might often matter more to the people with the experiences. A first stab, as I say here, at some important and under-recognized distinctions and various sub-distinctions under these 5 chapters or sections or headings, whatever you want to call them. First, you might have unusual experiences related to external reality, and yet this comes up in assessment scales for anomalous self-experiences. But you might have weird experiences of external reality rather than yourself. The environment might feel distant. You might feel like you're cut off from the rest of the world, but like this is a world problem rather than a you problem. It might seem flimsy, shifting, not as stable and reliable as external reality is supposed to be. It might seem flat and artificial, like you're in like a cheap studio set in a TV studio or something instead of in like an actual real environment. Then you might have weird experiences centered around your physical body. It might feel disconnected from your mental life. It might feel more like some vehicle that you drive around in or a tool that you can manipulate than an actual part of you. You might have the experience that body parts act of their own accord. You might have strange experiences when it comes to your emotions. You might feel emotionally flatline. You might feel like you hardly have any emotions at all. Emotions might feel implanted, like they're not really your emotions, but put inside you. You may not feel your emotions in what is supposedly the normal body location for that emotion. Like anxiety is supposed to be felt in the chest, like a tightening in the chest or like a lump in the throat maybe. If you sort of have this nervous, excited enthusiasm, it's supposed to be felt like butterflies in your stomach, but maybe you feel all your experiences, all your emotions as if they're all sitting inside your head. or you might have emotions that don't at all feel like they're spatially located in any particular place inside you. You might have strange experiences with your thoughts. It might feel hard to think at all. Your head might feel just empty, or like it's filled up with porridge, which I realize now as I'm reading from this slide, it might be more of a Swedish idiom. I think in English you would say it's like your head is full of cotton, but you get the picture. Some thoughts might feel implanted. Again, as with emotions, you might feel like some thoughts are implanted in you. They're not coming from you. They're not really yours. You might feel your thoughts as spatially located, which you're not really supposed to do. It's your emotions that are supposed to be spatially located in your stomach and chest and so on. Your thoughts are not supposed to have this spatial feel to them, as if they're sitting at specific places inside your head, but you might still have that experience. You might like feel them slithering around or crawling around inside your head and so on. And your very self might feel odd in some way. You might feel devoid of self, like you have completely lost yourself, like you're no one, or you feel yourself shattered. You might feel like more selves than one. So I'm going to go through these one at a time and say something more about each point. So first, when it comes to external reality, here I think are some underappreciated distinctions. So because all of these, the environment feels distant, you're cut off from it, it's flimsy and shifting or flat and artificial, all of these can occur together with a full-blown sense of self and agency. I am myself, I can think, I can plan, but I have been dropped into this weird situation where everything is constantly shifting or where everything is flat like a movie studio. And of course, say a wildly shifting, for instance, environment will make it hard to properly think about that environment because it's changing all the time. It will make it hard to plan and to act because you don't have any stable set of information to take into account. But this difficulty on its own is quite analogous, I think, to difficulties that sane and neurotypical individuals can experience if they end up for some reason in some place which is very stressful, where there's tons going on all the time, right? So this is a problem, but it's not the same problem and need not occur together with problems that might more properly be called like problems of the self or problems of agency. Then we have weird experiences with the physical body. And so if we first look at the dissociative phenomenon, where your body feels somewhat disconnected, like more like a vehicle that you drive or a tool you manipulate than part of you. This is not necessarily as much of a problem as it might seem if you get sufficiently used to it. There is some empirical research, and it's often mentioned as being paradoxical, that there is this tendency for people who have had dissociation symptoms for a long time to report that they suffer less from these symptoms than people who have had them just for a short time. And also if they are sort of very strong and prevalent, they might give rise to less suffering than if they are more on, off, and a little weaker. But I think that makes sense because if you have a pretty strong experience of your body as more of an object, and you have that for some time, then you can adapt, you can get used to it and adapt. So, I mean, this can obviously be a problem if it is disturbing in itself and a constant source of distress, or if you if you're prone to hurting yourself by accident, for instance. But if you manage to adapt, it need not be that problematic. It's surely more inherently problematic if you have this passivity phenomenon where body parts seem to act of their own accord. But even there, you might have some ways to sort of indirectly work around this. It also matters how, so to speak, benevolently they act when you have passivity phenomena. It's not just the passivity phenomena in itself that is a problem. It matters a lot too how much conflict there is, so to speak, between, well, say, hands that write their own stuff on the keyboard when you're at the computer and your conscious self. Being a little disconnected from some parts of your body and having some passivity phenomena can be worse or less bad, depending on the level of conflict and hostility you experience. Then there are emotions. And here I think an important distinction that tends to be really underappreciated is between first of all, having almost no emotions, anhedonia, emotionally flatlined, or feel like really estranged from your emotions, like they're implanted. These are at least strongly prima facie problematic. But not feeling your emotions in their like proper bodily locations, I don't think this need to be a problem at all. It can just be a neutral difference. But there is a tendency in mental health treatment to just lump C together with A and B here and think that not having your emotions in their proper bodily place equates having a very flatlined emotional life. Being unemotional or being alienated from your emotions. But I don't know of any actual research on this. So this is merely anecdotal from my own experiences and from talking to other mad philosophers who both have these experiences, but also tend to think and analyze them in a way that your average psychiatric patient might not do. C can occur without A and B. You can have really strong emotions that you identify with, they're just in some unusual place or not experienced as being in any place at all. And then this need not be a problem at all. It's just a difference and should be recognized as just a difference in mental health treatment. Then there are unusual experiences with regards to thoughts. Once again here, I think it's important to separate out C on this slide. Feeling one's thoughts as if they're spatially located in specific places in your head, or maybe in other places of the body, I don't know. Perhaps that is also something that some people experience. Even though with thoughts, they are not supposed to be spatially located, that is not considered normal. But even so, that in itself, it's hard to see why it would in itself be a problem rather than just a difference. Having thoughts that feel implanted, on the other hand, can be pretty distressing. Although, as with the previously mentioned passivity phenomenon, where you feel like your body parts are acting on their own accord, a lot also depends on how much conflict there is. Because you can have thoughts that feel implanted, but at the same time, they don't have problematic content in themselves. They are pretty fine, and this need not be very disturbing, at least not if you have gotten used to this sensation because it's gone on for some time. So how much conflict there is might be more important than whether you have the phenomenon in the first place. When it's really hard to think, head feels empty or filled with some thick stuff, that's likely the biggest of these psychiatry problems, that will kind of mess with anything you try to do. So once again, some important distinctions here. Thoughts can be unusual in some sense. That doesn't necessarily mean you have a serious problem. It depends on the details. And then finally, there is the self. And this is where I get into stuff that I really have no personal experience with, as far as I can recall at least. Because I've always felt that whatever happens with my external reality, with my physical body, with the rest of the stuff inside my head, there's always a little self there that is me, and it's reliable and it's firm, but not everyone have such a reliable little self. And sometimes people feel devoid of self, like they completely lose themselves. They feel like their selves shatter. But there are also people diagnosed with DID, for instance, who experience that there are more selves than one inside them. And that seems to be something people can learn to live quite well with. They don't necessarily need to reintegrate into one proper self in order to function and feel okay about themselves. So then, once again, it's important to distinguish that then from some kind of terrible, destructive self-shattering, or just a sort of loss of self, where you feel like you've lost yourself completely and like you're no one at all anymore. Maybe I should have, I just realized this right now as I'm talking, maybe I should have made 2 more subdivisions here under A, because feeling devoid of self is sometimes something people talk about as a positive transformative experience in deep meditation or psychedelics use, or like sort of spiritual spontaneous experiences, but they can also talk about it as something horrible. So maybe I should have put even more distinctions here. Anyway, these are just some concluding remarks, that this has been very much a first stab at articulating some distinctions that I think are both philosophically interesting and often important to the person themselves. And one reason for this is that whether you're a psychiatric patient or attempt to handle things on your own for one reason or another, it's unlikely that you're going to have access to treatment that simply fixes the dissociation and makes it go away. That's almost never the case in psychiatry. You can get sort of cognitive behavioral therapy and that kind of stuff. You can get medication. That might help you with symptoms more or less, though often different people react pretty differently to the same kind of pills, to the same kind of CBT exercises and so on. But even when treatment is considered quite efficient, it's unlikely to just fix you and make you go normal, so to speak. So you're likely going to have to deal with your dissociation issues to some extent. And then it makes a pretty big difference, for instance, whether you feel that you still have a stable self, even though weird shit happens around that self, or whether your very self is affected. That can make a huge difference to the kind of strategies that are available for you or will be effective for you. So these kind of distinctions between more or less intact agency, for instance, do I have all my thoughts with me, or do I have some alien thoughts that I must plan around? Do I have my whole body with me? Or do I have like some rogue body parts that I can at best cooperate with? do I have both body and mind with me, kind of like a normal person? It's just that my world has gone flickering or flat or weird in some way. So these are pretty important distinctions when it comes to trying to find a way to deal with yourself and your life. And they might be at least as important as the distinction between intact versus undermined reality testing. And that was my talk.